Hi, my name is Laura and this is my presentation on Chapter 1. So firstly, what are the differences between public health and community healthcare settings? Public health is focused on improved health amongst populations and it aims to address factors that influence health and the causes of illness by advocating for health and prevention of disease. Impacts of food production, distribution and consumption on health and nutrition are considered along with the knowledge, skills, behaviours and attitudes of the broader population. Many public health strategies exist and some of these include environmental health, nutrition strategies, healthy food and drink choices for retail, monitoring nutrition data, population health and screening and preventative health. Community health is primary healthcare with particular focus on those at risk of poorer health. Services provide holistic care concerned with not only the biological and medical factors, but also the social, environmental and economic factors that impact on health. Delivery of services is person-centred, flexible and responsive to the needs of the community. Many community healthcare services exist. Some of these include allied health services, disability services, refugee health, dental healthcare, health promotion and post-acute care services. Co-Health is one such community health service provider that offers many of these services. Established over a period of 2013-2014, Co-Health is the amalgamation of 3 community healthcare centres. The organisational structure of Co-Health comprises of the Chief Executive, Executive Directors, Executive Assistants and Senior Managers. Co-Health has many inter-organisational relationships in the provision of services. There are many ways to access services at Co-Health. Appointments can be made at Co-Health Community Health Centres across 30 service sites within 14 local government areas. Dietitian outreach services exist as well, such as home visits, and access can be gained through phone, webpage and email. As Co-Health has been established from 3 prior organisations, the resulting larger organisation means more substantial investment in people within communities and in research. Provision of a more accessible, equitable health service, provision of a low-cost, high-quality healthcare that all individuals can access. It's effective in supporting large numbers of individuals from disadvantaged backgrounds gain access to healthcare and services approximately 111,000 people per annum. The community expectations of Co-Health are that everyone has the right to access healthcare. Consumers can expect that services are equitable, affordable and readily accessible for all individuals. Consumers have the right to be informed about treatment options, costs, services and programs, access to safe and high quality standard of care, the right to be treated with respect, access to culturally competent service providers and for Co-Health to advocate on behalf of disadvantaged groups. Community involvement occurs through Co-Health's participation register, volunteers, community groups, memberships and student placements. Some of the ways in which Co-Health has a role in provision of healthcare and promoting healthy eating habits is through the Cafe Meals program, dietetic consultations, rooming house cooking demonstrations and the Billabong barbecue. Co-Health also reduces barriers to healthy eating from an internal perspective by providing access to dietitians for individual consultations, supermarket tours, improving food preparation to help chewing and swallowing, and addressing food insecurity issues. Externally, the barriers are reduced by the Arrowsmith Healthy Living Group, community gardens, cheap eats and free meals directories, and cooking classes. Make a successful community healthcare centre are accessibility, relevance, integration, empowerment, inclusiveness and participation. How does Co-Health meet these elements? By providing access to services for the most disadvantaged groups and assistance in finding appropriate services, by conducting audits and reviews to improve service and relevance of services, and through Co-Health's partnerships, Co-Health services link with other services provided within the community. Working in partnership to pilot new models of service delivery and review and improvement of existing services, Co-Health also prioritises services for individuals with complex care needs and disadvantaged groups, and Co-Health has client and community input at all levels in planning and delivery of services. A culturally competent practitioner develops appreciation appreciation of how culture influences beliefs, values, and practices, and has a self-awareness of one's own cultural background. They can perform culturally sensitive assessments and interviews and develop knowledge on various food practices, customs, and attitudes of seeking health information. They also have knowledge based on common nutritional problems and issues within specific cultures. They can engage in cross-cultural encounters, and for a practitioner to be a genuinely effective, culturally competent service provider, there must be sincere engagement in the process of becoming culturally competent. Cultural competency can impact on health by the removal of language barriers to ensure the health information is being received, ensures all cultures, literacy levels, and ethnicities understand key delivery messages and can engage in their healthcare. Health information provided considers the values, beliefs, and cultural practices of the population group and is person-centered, taking into account all of these factors.